Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose Naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Summerwood Pharmacy and Compounding is an integrative pharmacy focusing on the whole person rather than a prescription. Among other drugs, they compound LDN and offer free shipping to patients all over the state of Texas. They are passionate about you and your health. Visit summerwoodrx.com. I'd like to introduce my guest today, who's Dr. Marie Ekpema. She's from Houston in Texas. Thank you for joining us today, Marie.
Thank you for having me.
So when did you first decide to become a pharmacist?
Oh, my goodness. I first decided to become a pharmacist when I was a little girl. My grandfather was an herbalist. He was a businessman, but he quickly realized that many of the solutions offered by the medical doctors in the area were just not what was right for him and his family. So he decided to start studying and really researching, and it really made a big difference in his life and in the lives of his children and extended family. And believe it or not, he lived to be 102 years old. So that greatly inspired me to go into pharmacy. But then the second part of my career, going into pharmacy is one thing, but trying to specialize in more natural solutions for patients and coming to healthcare with a more integrative approach is something that I realized was greatly needed after I became a pharmacist.
Mm-hmm. Okay. So how many years have you been qualified?
I've been a pharmacist now almost 15 years, but I will say that the first part of my career was what we would consider as being a traditional pharmacist, kind of like what you would get if you walk into most pharmacies or most chain pharmacies here in the United States. I quickly realized that most patients who come in need so much more than just a pharmacist filling their high blood pressure medication or filling their cholesterol medication. I realized that there was a great need in helping patients who had gut issues or addressing drug-induced nutrient deficiencies. These are all the things that unfortunately we don't think about. Something as simple as a headache, for example, could be as a result of a magnesium deficiency. And no one really thinks about offering pre-diabetics other solutions. The first option, of course, here in the States for most patients is to start them off on metformin. And we have realized by carefully working with doctors and patients with regard to supplements and also, putting them on an adjustment of their lifestyle choices, which may be causing them to have problems, many patients don't have to be on as many prescriptions. And most importantly, I also believe by targeting certain just being more targeted with medications, we can be able to get better outcomes. And I've noticed that many of our patients have gone down from being on almost a dozen medications to just a handful and some none, by just really thinking closely about what we're doing and not just saying, well, this patient has this is what the guidelines say, and this is what we're going to do. There's so many more options, and we are able to offer patients these solutions also with compounding. So it's really, I didn't realize this until I had been practicing for almost 6-7 years. I just got tired of looking at my patients and not getting the results. And so I decided to essentially go back to school, start studying, start researching, getting additional training in compounding and bioidentical hormone replacement therapy. And I noticed that that effort that I put into educating myself further has really benefited my patients and their physicians.
Wow, that is amazing. I have MS, and I had been given 3 courses of intravenous steroids in an 18-month period, and I had gained 6 stone, which is 6 times 14 pounds. So you can imagine an awful lot.
Yes.
And I became a diabetic, type 2 diabetic. Yeah. And my face was round and red. I looked like a tomato, and I'm a very pale person. And I had to take metformin, and everything sort of stayed the same for quite a few years. And then I was already on LDN. I was on LDN like a year after all these steroids, but I was still a diabetic, and I was still taking the metformin. But then I changed my diet, took out gluten, added sugar, and what's the third thing? Dairy. And then I think it was about 6 months later, I had a blood test, and I was pre-diabetic. So I was able to stop the metformin. I went back again and had further checks, and I have done annually since. And I've still managed to keep it into that pre-diabetic, but that didn't come from my doctor. That was me doing it myself. But I think, to have pharmacies out there, it's different. The pharmacies that you have than we have. We don't have compounding pharmacists. So we do have the doctors, the pharmacists, like you were saying, that hand out the medications and make sure there's no indication with them, but they don't make suggestions. So I think people doing that and getting people off these cocktail of medications is amazing, because you know yourself that when people are starting to take 10 or more medications, they then tend to have to take another medication to combat the side effects from all these other medications. So that's an amazing thing you're doing there.
Absolutely, and I'm really proud of you. I think that many times, I'm a pharmacist, and I think that many times we in the healthcare profession tend to underestimate our patients. I think that quite frequently a lot of my physician and pharmacist friends say, well, I don't have time for that. I'm just going to recommend this medication. They're not going to do it anyway. And what we really focus on is empowering people. And I think that when people know that they are at the deciding table of their health care, and they can see that, these actions produce these results, and they see the good results, most people are willing to at least try. Most people are willing to at least say, maybe I can, get rid of gluten. That's one of the things that we sometimes recommend to people is the gluten and the dairy and the sugar. And we just tell them, listen, we give them either 60 days or 90 days, and we tell them if you don't get good results from this program, you can go back to doing what you were doing before. And I will say that the vast majority of people, once they start seeing results, are able to continue and stay on the program for a lifetime, because the reality is that most prescription medications, not all, but most prescription medications are intended to manage a disease. Very infrequently would you find a prescription that is meant to cure, unless it is an antibiotic, an antifungal, just a few here and there. And so you're going to get the best results when you modify your diet, you include certain nutritional supplements and lifestyle modifications. That's where you're going to see the needle really moving when it comes to most autoimmune diseases that we have.
Mm-hmm. I think so many people like myself, you're told you're a diabetic and you're going to have to take this medication for the rest of your life. You believe it. You don't realise it can be reversed. And I have spoken to a few people now who have also managed to get their diabetes into remission. And I think there should be more education out there, because I think if people realised there was something that they could do to remove that label, and to have to, stop the metformin, to make people aware that that is an option. It is possible to do that.
It is. It is. It's very possible to reverse. And what I tell people is sometimes you cannot reverse certain conditions,
Yeah.
And I'm 100% okay with that. I am realistic. However, when I see a patient of mine go from using 100 units of insulin every day, and they're able to back down to using maybe 10 or 20,
wow.
And when I see some going from 4 or 5 different medications every day to control their diabetes, and they go down to taking one, that's progress. That's incredible, because when they do that, they're not only just helping their diabetes, but for the majority of people, they may have other things happen. For example, they may have a reduction in the pain that they're getting from an autoimmune disease. They may get a reduction in their blood pressure. And so these are the things that we tell people. Now, while you may not get off of all of your medications, there are also other benefits to really making the choices that you have made in your life, and I've made in mine. Unfortunately, many of us healthcare professionals are not always the healthiest. We preach, but we don't always practice. And so it's very important that people understand that baby steps are still steps. And so we're proud of people. We want them to continue at least trying to reach their goals.
I'll just ask you this. I also have high cholesterol, and I was told my mother had a major heart attack, and that was due to what they said was hereditary high cholesterol. I had mine taken, and I was told that it was so high that I was likely to have a heart attack or a stroke at any time. So I wouldn't have been tested. So my mother having her heart attack saved me from having one. My eldest daughter was fine. My youngest daughter was borderline, and she was only like 10 at the time. So I was saying to the specialist, okay, I've got this problem. So if I change my diet, could I actually get it down rather than taking a statin? And he said to me, if you lived on a glass of water and a lettuce leaf every day, you would still have high cholesterol. The diet side of it isn't going to bring it down. So I took the tablets and brought it down. It was in range. And then I thought, well, let me try and see if I can do without it. But then it went straight back up again. So the answer to that was no, I couldn't. But I don't know whether there are any alternatives that you could take instead of taking a statin. I mean, have I really got to take it for the rest of my life? Is there any way of helping my body to reduce the cholesterol itself?
Well, there are different types of cholesterol. Obviously, when you look at someone who has familial hypercholesterolemia, we're looking at a situation where that is true. Even if you just had a glass of water and a leaf every day, you probably would still have that. However, we still know that just your cholesterol being high by itself is not enough to put you in a situation where you have a heart attack. So we do know that there are other things that you can do to reduce inflammation within your vessels. We do know that there's been a lot of studies surrounding pomegranate juice. Drinking that every day can help. We do know that, once again, reducing inflammatory foods in your diet can help significantly, including things like garlic in your diet can help to, and exercise can help to increase your HDL, which can be cardioprotective. So while, yes, for many people who have the familial disease, vast majority of those people do have to be on statins. There are other things that you can do that could also not only reduce the dose of the statin that you may have to be on, but also reduce your chances of actually having a heart attack. So, yes, diet still matters. And unfortunately, what happens is when these people are told, well, yeah, even if you drank water every day, you would still have this problem, just give up. Many of them just give up. They say, well, it doesn't matter what I do. I'm still going to have a problem. We don't want people to do that. We do want them to still consider making the correct choices. There are different things that you can do to reduce inflammation with regard to supplements. And, of course, we try to tailor that to the patient. We try to consider the prescription medications they're taking, their age, their comorbidities, and that will drive what type of supplements we offer them. So definitely, you can do things. I would not give up. I would still continue to include different natural therapies in your diet, obviously with the direction of either a physician or a pharmacist like me who sees many patients in that situation.
Mm-hmm. So how does patients get to have a consultation with you? Do they just book that through your pharmacy?
Yes, they can contact the pharmacy, and usually we have an intake form. We do consultations in the pharmacy. We do consultations over the phone, and so they'll fill out the form and give us all their medical history. Also, let us know which prescriptions they're on. We also like to be in communication with the physicians. It's very important that we are on board with the physician. And then after we do that, we can determine what's needed, whether or not, they need some additional testing done, or whether or not in some cases, for some people, we tell them that we believe that the therapy the doctor has them on, their medical doctor has them on, is working fine or is the safest for them at that point. And so the initial thing would be to contact the pharmacy, either via phone or via email. Our phone number is 281-225-4300, or via email at info@summerwoodrx.com. And, we have staff that are very well used to us getting phone calls from many, many people, and we are definitely passionate about helping people to take charge of their lives.
Mm-hmm. And do you have a waiting list?
We do. Depending on the time of the year, the waiting list could be anywhere from a couple of weeks to a month. So when they call the pharmacy, the pharmacist or the technician who picks up can let them know where we are in the list. Mm-hmm. We tend to be a little busier during the summer because a lot of people like to start new things during the summer when their children are out of school. We have a lot of parents who use us to help them with children who have ADD, ADHD diagnoses, and so the summer is kind of a good time to make changes without disrupting their school life. But it doesn't mean that we can't help people. We just encourage them to call us and find out where we are on the list, and we can work them in.
Mm-hmm. And LDN, what forms do you supply or compound LDN in?
The vast majority of LDN compounds that we make are in the capsule form or in the topical form. We have seen so many patients benefit greatly from LDN, and we whenever we have someone who comes in and they're on prescription medication and they're just not responding the way they need to, we reach out to the physician to recommend that the patient is tried on LDN. We love the capsules are an easy way to ingest LDN. However, it can be used topically for many conditions. We compound LDN anywhere from 0.5 milligrams to the majority of patients stop at 4.5, but occasionally we have people who go up to 6 milligrams of LDN.
Mm-hmm. And what have patients' outcomes been?
We have had people really, it's been fantastic. We have had patients who've been on medication after medication after medication, and they've noticed that the severity of their symptoms have greatly reduced with regard to pain. The most dramatic result would be a woman who was using LDN for her psoriasis, and she noticed almost a 70 to 80% improvement. And so those are some of the stories that we experience here. However, we want people to also be realistic, and the realistic aspect of this is that LDN is not for everyone. And in addition to that, if you're not titrated up slowly, some patients may not get the results that they believe or hope to get. And also a very important thing would be nutritional support. Many people who suffer from autoimmune diseases, have to have good nutritional support, especially gut health. And this kind of comes into play when we're dealing with the low-dose naltrexone taken orally. If you have leaky gut syndrome, or if the bacteria in your gut is not balanced, you're not going to get good results, because keep in mind, this drug has to be absorbed. And so these are one of the things that we try to help people do, is to balance their gut health, because when the gut is balanced, you're able to absorb the medications better. And actually, for some people, they're able to actually have a reduction in the symptoms that they are experiencing.
Has anybody ever notified you of any adverse side effects?
Yes. We occasionally, some people may kind of complain of some bad dreams or, trouble sleeping. And really what we recommend at that point, usually most people who experience that are people who have been started off on the higher end of low-dose naltrexone. So like I said, we can compound it all as low as 0.5 milligrams. So usually if we're dealing with a physician who's not well experienced, or maybe they just saw 4.5 milligrams and they want to start there, we have a communication with them, and we tell them it's very important to slowly titrate the patient up. That can reduce the chances of the person having the nightmares, and also kind of waiting to see if they experience benefit, because everyone doesn't need to be on 4.5 milligrams. Everybody doesn't need to be on 6. So some people get good results on lower strengths. I have had maybe just a few people experience that, but the benefits that they experience so much outweigh the side effects of that sometimes occasional bad dreams that most people are able to ignore that. And we also find that including some magnesium glycinate helps people have a more restful sleep, and in some people eliminates that.
Mm-hmm. What population would you say you normally treat with LDN? Are they young people, middle-aged people, older people?
I tend to find that the majority of my patients tend to be middle-aged and older. I do believe that, and then it really depends on the physician. A lot of times we have a lot of education to do with regard to physicians who've been practicing for a while. And so I tend to find that, the younger physicians, ones that maybe graduated within the past maybe 15 years or less, maybe 20 years or less, they tend to be more open to that, and they tend to recommend it more to, I would say, middle-aged to older patients. Every now and then we have a young patient here and there, but mostly it's middle-aged to older patients. What I will say is that, and this is just something that bothers me, is that sometimes we do, have patients who are told to use the 50 milligram tablet of naltrexone, which is available commercially. And, they're told to just cut it in half or cut it in pieces or dissolve it in water. or dissolve it in a drink, and sometimes that tends to be the direction given to younger patients, which I don't like. There's no way to guarantee results, and so that's what I have noticed a few times, and that bothers me deeply as a pharmacist.
It bothers me as well, and especially when people either buy the Naltrexone online, the 50 milligram tablets, or buy the LDN online. Because when you buy a prescription-only medication online, that means that medication hasn't been through the tests. There's been no regulation or anything. And I have seen what pharmacists have to go through with their testing and their regulations, and you can put your hand on your heart and say there is definitely 4.5 milligrams in this capsule, there is 3 milligrams in that capsule. I know it's been tested, it is what it says it is. But if you're buying it, it could be anything, and to play Russian roulette with your life is very scary. It's not something I would recommend anybody doing. An LDN,
I would not recommend it. Yeah. It kind of bothers me when I see that. It deeply, I beg people, I said, please, I know that you've seen something online or a friend of yours, and I tell them, I said, I hate to put us on the chopping block, but if something happens to you and you walk into a pharmacy, you can walk back into that pharmacy and point a finger. You can call a regulatory agency to do something. If you buy something online, the company may just take down the website and disconnect their phones, and nothing happened. And in fine print, what most people don't realize is that most of these websites say they're not responsible for anything that happens to you. And many of these drugs are laced with things like carfentanil, which is a highly potent drug that can kill you in very, very low concentrations. And so not only that, we're dealing with purity standards. We are members of the Professional Compounding Centers of America, so we can tell people without a doubt that what they're getting is what they're getting, and we also do third-party testing. So that's very important to question. And if the company you're buying this from is not a pharmacy, they cannot answer these questions, unfortunately.
Definitely. We buy prescription or have prescriptions filled at pharmacies for a reason. It's not just the fact. Yeah, it's definitely a good thing to make sure that everything is above board and is what it is meant to be. But we've run out of time, and it's been amazing talking to you. And, thank you so much for what you do to help everybody.
Thank you for everything you do. I really I'm grateful that your show exists, your organization exists. It's helping many people, and we're just honored and humbled to be a part of the process.
Well, thank you so much.
Thank you.
Summerwood Pharmacy and Compounding is an integrative pharmacy focusing on the whole person rather than a prescription. Among other drugs, they compound LDN and offer free shipping to patients all over the state of Texas. They are passionate about you and your health. Visit summerwoodrx.com. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.